Hey guys, everybody, you're welcome. This is our daily podcast from PICS. This is Friday, the 6th of September. So we're just going to go through the last 24 hours of the meeting. We've had a great meeting. I'm really lucky to be joined by Dr. Gareth Morgan, who's the director of the Cath Lab in the University of Colorado. So Gareth, what did you think was good over the meeting in the last 24 hours, the sessions you went to?
Well, it's been brilliant as usual, Damien. The venue this year has been really enjoyable. I think the highlight for me was probably the award session last night. I think everybody really enjoyed the very emotional tribute that you paid to Dr. Evans-Ann when he got the Lifetime Achievement Award last night. I think that was brilliant. Everybody really appreciated that. It's a great thing for Evan to get. The live sessions, as always, and I'm sure everybody says this, the live sessions have been fantastic. The range of equipment on view, the engagement from industry, the pulmonary valves that we've seen, I think that's been fantastic. And the 3D-i3 section as well, which I was lucky to be involved with, I thought showed some really innovative imaging technology that's going to be very important for all our colleagues for the next 10, 20, 30 years.
One of the things I was really impressed about, and I don't know about you, is the live cases today, whether you felt, we had 2 live case operators who decided not to proceed with their intervention because they just felt it wasn't appropriate. Sometimes there's been criticism of the live case format that it may precipitate operators not to do the right thing, and I think we saw that that's just not the case today.
It's true. It's great getting opinions from experts on panels, but we all have to recognise that the people looking after the patients are the operators in the lab, and we have to respect the fact that they make the best decisions to keep their patients safe. And you're right, today was a great example of that. The guys that decided the best thing to do is to stop and not use the equipment and have an honest discussion about and with the patient about the best way forward. I think that was really important to see, showing that people aren't being forced into interventions that maybe aren't the best thing for their patient.
Yeah, absolutely. And some of the other sessions we've had over the last 24 hours with the VST session, I was at that, I thought it was great. We had, some of our Asian colleagues talking about how to close doubly committed subarterial VSDs and also how to close the VSDs with aortic valve prolapse. And I think it's really important that we take on board their experience in relation to doing these procedures. And I think we need to realise that we're all here to try and do what's best for our patient, and sometimes surgery is the best option.
That's true, but I think I'd echo what you said in the first half of that. The experience that some of the Asian operators have can really have a huge impact on practice in Western countries. So US, Europe and the UK all have to look at some of the really innovative practice that's going on in Asia and applaud the guys there for actually driving the field forward, particularly in areas like VSD closure.
Yeah. And then just one last thing that we did was the Shark Tank. Did you enjoy that last night?
I thought it was great. I have to say, a worthy winner, but some really good, strong competition and some very, very out there, interesting ideas that nobody expected. I mean, some of the stuff that was presented, I don't think anyone was expecting at all. So fantastic to see how people's very lateral thinking can bring really innovative stuff, and I thought it was really enjoyable. And
obviously Martin Brock's winning it. Congratulations to Martin. The concept of a bioresorbable ASD occluder, it kind of has to happen, doesn't it?
It's what everybody wants. I think I can't imagine anybody thinking that we're not going to be using bioresorbable occluders regularly within the next 5 to 10 years, and I thought that was a really good vote of confidence for that technology, seeing Martin win that.
Great. Well, thanks to Gareth. We've got one more day to go. We've got some afternoon sessions and some live cases tomorrow, so we'll touch base with you tomorrow afternoon to wrap up the meeting, and thanks again.